Hi, everyone. My name's Kenna. I'm presenting with Anna, Sarah, and Adriana, and our topic is over multiple sclerosis. We did a quick review of the types of multiple sclerosis on this slide, but we went over them in class, so if you need a refresher, here it is. And then some diagnoses, some changes that come with it. The symptoms and changes typically depend on which area of the brain or nervous system that is impacted. Some common physical changes are sensory disturbances such as dysesthesia, paresthesia, urinary incontinence, erectile dysfunction, and numbness. MS can also cause muscle weakness and coordination, pain, spasticity, and fatigue. Fatigue is the most common complaint and usually identified as the most debilitating symptom of MS. Visual disturbances are among the earliest signs of MS. Some visual deficits are partial loss of vision, diplopia, or unilateral optic neuritis. Some cognitive changes include short-term memory, attention, processing speed, and executive functioning. And then lastly, emotional changes that are associated with multiple sclerosis are depression, euphoria, lability, and changes in one's quality of life, employment rate, and social engagement.
So here are some assessments that you can use for people with MS. The first one would be the fatigue severity scale. It's just a short questionnaire that rates the level of fatigue they're experiencing. It contains 9 statements and you rate it based on the severity of the symptoms. It's based on the previous week of that person. So you just circle the number from 1 to 7, with 1 being disagree and 7 being the most, and then you add up all the numbers to get a final score. A score of 36 means you need to see a doctor to address the fatigue symptoms, and a score less than 36 means that you might not be suffering from fatigue or it might be very little. The next assessment would be the FAMS, which is the Functional Assessment of MS. It has 59 items in it with 6 quality of life domains, including mobility, symptoms, emotional well-being, thinking, family, social, and well-being, and general contentment. It's on a 5-point Likert scale with 0 means not at all and 4 meaning very much. And the scores can range from 0 to 176. And then you add it all up with a higher score meaning a higher quality of life.
Another thing that we can see being affected by MS is balance, so we decided to talk about the Berg Balance Scale as well. The Berg Balance Scale has 14 components of balance seen listed on the right side of the screen. Some of them include sitting to standing, standing unsupported, sitting unsupported, etc. The client has the possibility to achieve 56 points with a higher score indicating a lower fall risk. A score of 0 to 20 is considered a very high fall risk. This could be a good thing to assess due to a loss of strength and balance, which may present fall risks and affect safety. It could be good to continuously monitor balance as needed to inform use of mobility devices. Now we will talk about interventions. One important intervention would be an intervention to address activity tolerance. For the sake of this presentation, we chose to talk about grocery shopping. This is a good way to practice standing endurance and enduring the activity of grocery shopping, as grocery shopping often involves walking great lengths around grocery stores. It can also be used to address scanning techniques and look at visual attention, as the user may need to scan to find lower price options and look at a lot of distracting stimuli. During the grocery shopping activity, it'd be great to educate on energy conservation techniques. One way you can do this is by identifying spots to rest or signs of fatigue. You could also work on pre-planning and creating efficient routes throughout the grocery store. To grade this activity, you may want to alter the length of the grocery list, use of external memory cues like grocery list. If you want to address more of a cognition component, you could try without a grocery list, and then you can try to build up going longer periods without breaks. It may also be effective to look into online shopping as an alternative, as these people typically have intact cognition. Or if they want to try to switch it up, you could try buying your own produce, as this section is normally in the front of the store and has great variation between the products, and then going through a drive-through online pickup option for the rest of your groceries.
Another good intervention that we could use are crafts or construction kits. These are pretty great because they promote usage of both fine and gross motor movements, and this can be in both the upper and lower extremity. And they're pretty universal in terms of energy level or movement ability, because it could be something as complex as a motor car or train kit, which has a lot of little pieces and a lot of steps, to something as simple as a small Lego set or a small puzzle that doesn't really have a lot of components to it. And this makes these kits very easy to scale based off of the individual as well as their certain interests. Maybe somebody is more interested in something like painting or putting stickers together as opposed to putting kits together. So any craft construction kit that emphasizes the fine and gross motor movements as much as possible would be most beneficial. We just need to take into account their energy level. Another intervention that mostly focuses on the emotional symptoms and signs of MS are group activities. These can help prevent depression and withdrawal from social activities. Our overall goal is to have people engage as much with their community, their environment, their friends and family as much as they can. And these can be graded based off of where the individual lives, their close proximity to friends and family, and what they want these groups to be. They could be support groups, which are more leisure-based and focus on people with MS coming together to exchange treatment ideas, share stories, and feel heard from one another. The overall goal is to make sure that people with MS know that they are not alone in their disease and to build a strong community. You could also do a more social group, which is interest-based and engagement with the community. This could be setting up a time for everybody to go get coffee together and just making sure that everybody in the group knows everybody's energy tolerance and their fatigue level. And here are our references.